Welcome back to Addiction, Recovery, and Mental Health, a podcast by Waismann Method Opioid Treatment Specialists. I'm your co-host, Dwight Hurst, and joined as always by Claire Waismann and David Livingston. We are talking about PTSD and addiction today. With it, June is amongst the various, there's different months. It's Pride Month. I just learned it's also Men's Mental Health Month, but one of the things that's commemorated in June is PTSD and PTSD awareness. And so that's right up our alley here on this show, is to talk about that. We do talk about the relationship with trauma and with mental health, and PTSD has kind of got its own wrinkles to it as well. How's everyone feeling on this topic? Where should we start today?
David, I'm going to let you open this door today.
Okay, you got it. So, maybe PTSD, I think, was maybe a good place to start was just a little information about it for if anybody isn't sure of what it is. It's post-traumatic stress disorder. So it was first, I think, created as a disorder for combat veterans or people who went through really chaotic experiences, often that had to do with death or dying was one of the major attributes that tended to be associated with it, with the diagnosis. So it is in essence being exposed to something traumatic, and it also can be can happen when people are sort of thrown into a level of chaos that overwhelms their sense of how they're organized, either internally, externally, or probably in some ways both. One of the things they've learned, particularly with PTSD, because we see a fair amount of people associated with military veterans and so forth who come through and who we work with. One of the things that's correlated to PTSD, and I've seen this in people I've worked with, is the perception that people bring into. So if you go to war, the people who are expecting it to be, for lack of better words, hell, tend to get less PTSD. If you're naive about it, it overwhelms you and surprises you at a level and can be more disorganizing. So that's one of the attributes to it. So some of the things that are associated with it is nightmares, high levels of anxiety, depression, depersonalization and disassociation, hyper responses to noises and sounds. And so some of those are more characteristic of the diagnosis. So maybe that's a place to start.
David, would you describe as somebody in constant alertness mode?
For sure. It's as if the nervous system is on high alert, and the ability to relax, because we're ultimately we're adaptive. So if you're in a prolonged state or period of vigilance, your nervous system actually can begin to adapt to that and make that more of the baseline. So you'll see that with combat veterans who have had, especially if they've had a lot of time in combat, especially, highly in dangerous and intensive situations. So their nervous systems adapt. And so yes.
Yeah. And it's interesting because some of the research that's been done shows different causes. I mean, like you said, it used to be from the development of the diagnosis, it was just kind of used as a combat thing, something more scientific than saying shell-shocked, which they used to say, right? And then it sort of branched out to say, I guess the research shows life-threatening experiences. And then it seems like it's gone a step further to say, actually, there's a lot of people who maybe weren't in danger of death, like those who were physically or sexually abused or had other events that also show the same symptoms and that qualify now for PTSD. And so we've seen kind of different gradients and different causes of trauma, but they seem to have a lot of the same dynamics, right?
Exactly. There's different ways to approach it, and there's a high correlation to, you can imagine why we see a fair amount of people who've been on opioids to try to help calm their nervous systems, or who get addicted while they're in combat, and then come back and are trying to find a way to lower their hyperarousal state, and through opioid use, which tends to work for a period and then actually makes it worse, and then it causes all kinds of other problems eventually. So it doesn't lead to what you need over time. But so we certainly see people and help and work with veterans coming off of opioids.
And man, that does seem to be a theme we see with a lot of dynamics and opiates, right? Even with pain to an extent. It works for a while and then doesn't, and then aggravates, right?
Well, yes, and similarly, pain throws a system into some level of chaos, and disorganizes. Pain's disorganizing, right? Because if you're in enough pain, it will disorganize your system. Because the pain, it's like instead of living in feeling relaxed inside, now you're living in two worlds. You're trying to organize the external world and the internal world, and then there's all kinds of other feelings and that get associated, anxieties, disruptions in sleep, all kinds of things that often occur.
Yeah.
So, David, I think it's important for us to talk because we see, a lot of patients struggling with PTSD that we treat, and then they go through the detox. Now, you have a person that feels raw, and all these symptoms that at one point were masked by the opioids are surfacing at full force. Um, what are the treatments? What is first? How do you deal with it as soon as they get detox, and what are the risks of them not having the appropriate care post detox? So if you can talk a little about how you handle those patients that wake up and do not know how to relax, do not know how to feel safe within their own boundaries. So yeah, just talk a bit about it, please.
Sure. So because we often see people who've been on opioids for a very long time, so because the course of opioids is they tend to regulate in the beginning. They help anxiety, depression for many people. They help pain, but that ramps up, and as the dosage ramps up, it comes to a plateau, and then you stand the plateau, and then it goes down the other side. And we see people very often who are coming down the other side. So ironically, even though, they're feeling their feelings more directly off the opioids, they're not going through the severe dysregulation that the opioids are causing, because at that level, as they're metabolizing the opioids quickly, as it's dysregulating their sleep, as it is affecting their mood and their ability to and their lives, frankly, just start to shut down. They do less. They're less involved with other people. So all the regulating forces that actually tend to elevate mood. So you come off and you're feeling your own feelings more directly, but those feelings are not, maybe in the most severe cases of people with PTSD, it can vary where that can be a lot, but in general, people feel better because it's our feelings and our sense of values and perceptions that begin to re-regulate, and not only regulate, but create a sense of well-being again, right? So all of a sudden it's fun to listen to music again. And you actually want to see your friend and the people you've been avoiding, who you realize you're missing. You want to talk to them. And so all these aspects of life that actually create meaning and a sense of value again are better. And so, yes, you're dealing with your feelings more acutely, but not just negatively after a period of time. And so one of the things that I see a lot is that people have been on opiates for a long time because they just needed the space, the distance between the trauma and the, and getting off the opioids. And then as the opioids worsen their life, they want off of them. We see them a lot then. And then actually they're better off. So that's not 100% the case. And often they have to go into and get the continued treatment. And there are different treatments that are known to be effective. EMDR's one that's been known to sort of help with the nervous system. I think massage is actually a therapeutic massage can be very helpful, just to help people's nervous systems. And then being able to slowly move into feelings, as I say to the patients, the goal is you talk about things in here as you need to, and then you shut it down. Okay. And then you walk out the door and you shut things down. And so what happens is there's a mechanism that can be put back into place where you can repress. You deal with them enough and then you repress them. Okay. Because you can't keep things open all the time. So you open the door and you shut it. And that combination can get put in place through effective therapy over time. Something like that.
Well, it's emotional regulation, right?
Very much.
And as we talk a lot on the show about the self-medication and that dynamic. And so yeah, I think what I'm hearing is you're talking about that is that there would be a certain amount of irresponsibility to help somebody get off of drug use and then not have anything there to replace that solution. Because we forget sometimes that drug abuse is a solution more than it is a problem. In other words, it's a bad solution. It's not a healthy.
It's a consequence instead of a solution, no?
But what I would say is it in the very beginning, it may be a solution, but not over time.
But it becomes its own problem, right? Yes, exactly.
Right, but in terms of the feelings, in terms of what the person experiences internally, the solution part of it has long passed. I mean, and truly, and so when they come off of it, yeah, if I'd say one of the most difficult things is is helping them trust enough to want to get reestablished in a relationship that can be therapeutic. And my hope is that they have a good enough experience here and with the care they get, that will instill the whole some hopefulness that can be carried forward.
And I think that is so incredibly important, David, because Dwight, like you said right now, that is irresponsible, to treat somebody and not have a replacement for the drugs in place. As great as it sounds, is not realistic. Because you can't have a treatment protocol that is going to fit everybody's needs or that everybody's going to follow. The second issue is, I believe that when you make someone that, especially with PTSD, that is so scared to commit to any treatment, they are so scared to open, themselves and get completely stabilized. It's really, really important, as David was saying, that they have a good experience so they start trusting again, so they feel comfortable within, their realm to actually open up to someone and start working on that. But we need to be very careful with, pre-deciding people's solution without really understanding their makeup and what they can withstand.
Isn't trust and lack or loss of trust one of the symptoms that we would run into with PTSD?
100%, because then there's, with the loss of trust, there is values and relationships, which is one of the most valuable things I think there is, maybe the most. If you can't trust and you can't let people in and you can't sort of, form, reciprocal, loving, relationships, then the value system is skewed, and then you're in a certain amount of chaos, and that is a part of PTSD.
I know that they've updated also a little bit when you talk about PTSD and it activates the panic system and you go into survival mode. I remember going to school and they'd always talk about the fight or flight response. And now they're talking in treatment circles about fight, flight, or freeze. And just the other day, I'd heard a fourth response pattern. They say fight, flight, freeze, or fawn, which oftentimes in violent and toxic relationships, someone will fawn or try to gain the approval of someone to protect themselves. That mainly is referring to domestic violence and toxic situations there. But I think we may underestimate the presence of that freeze response. And sometimes if someone's not raging or those types of things, we think, well, they're okay. They're just kind of quiet after these traumatic experiences. But then we start to get upset with them. Sometimes caretakers or family members will get frustrated that the person's not making decisions or that maybe they're not taking healthy choices. And then, of course, sometimes then the drug use or abuse starts. And we don't realize there's that freezing shutdown response when someone is being triggered, right?
Right. You see that in animals and in nature, and it's in us too, as a protective mechanism, and at times it's the most adaptive, but ultimately you need that health is, like we talk about, is the ability to move as you need to and you want to. So, but yes.
What about the element of shame that plays in PTSD? When you see people who've gone through trauma, and especially if drug use has then become a part of their coping or their attempt to cope, it seems like shame and the hesitancy to become vulnerable would be a big part of it. I mean, you see people hiding addiction. Do you see people, having how strong of a relationship is there between shame and the PTSD?
I think it's a combination of shame and fear. They're hiding. Sometimes even more fear than shame.
And often one of the things I think they're afraid of and maybe even ashamed of is how angry they are. Mm-hmm. That there's that one, with a loss of trust is a feeling of you lose a sense of humanity, because PTSD is very associated with experiences of either seeing someone die or death in some capacity. That's something we as human beings repress all the time. I think it was Freud who accurately said that, within our unconscious is everybody thinks that they're immortal. Okay, so once that has been, and you see this with combat vets, they don't think that or feel that and can't repress that the way we all do. We all forget about it. And thank goodness, because then we go on and we live our lives more fully. But what happens is when you can't forget about that in the same way, and so there are techniques and ways to help you begin to forget. And it may sound funny. I mean, it's no wonder that opioid use is correlated, because it is a way of dampening and trying to forget. So that, like I was saying in therapy, it's a great, one of the things I do when I'm talking with people who are dealing with PTSD is I make it crystal clear that we've done the work for today and you need to forget about everything until the next time we talk. And it's easier said than done. There's no question. And sometimes, it'll come out in dreams. Sometimes it comes out in other ways. And which is why you need a long runway. So in successful treatments, from my experience, what happens is there's a rhythm you get into where you deal with things and you repress things and shut them down. You open them up, you shut them down. And that, as that gets reestablished, it's part of the treatment for it, because then the person can actually deal with some of these things. There's a place to do it. And then they begin to really learn how to shut things down again, which is critical.
And that's a big part of a lot of the trauma therapies. I know with EMDR, it's all about triggering and processing responses differently, but they typically also have a startup and slow down, is my understanding. So I don't know if they call it, it's not exactly a terminology, but it's kind of a relaxation and decrease of that, because otherwise you find that it actually kicks things up, and people need to be able to regulate that. And in a way, it's interesting because practicing being able to do that naturally with our own psychology and our own physiology sort of then reduces, hopefully, the need to ingest a psychoactive substance or to abuse drugs to try to get that result. Because in a way, that's what we're trying to do with drug abuse, is we're trying to take an unnatural or what we think is an unnatural level of control over our feelings.
I'm just going to say this. It's one of my biggest complaints about the standard treatments in our field is that it's 8 or 10 hours of group therapies and this and that. It just overwhelms people. It's way too much. People are needing to learn how to lower and shut things down, and you have to find a balance. So the idea of more treatment is a terrible idea. It's really finding what allows that person to deal with things enough for that actually there's a titration, and then they can stay regulated for a period of time and forget for a period and then deal again. That's really the far more of my idea of it. But it's not so, and look, there can be a lot of in between socializing, going for walks, doing other things, talking with people, but just that stuff is all great. That can really help to just kind of, be some in between ground.
Well, and I feel like that's a more research-based, that's a more modern approach is, if you're talking about like in a residential treatment or kind of an inpatient or an intensive outpatient, to say we're going to do therapy groups every hour, I think is being replaced in the more progressive programs by saying, let's, take a walk. Let's get to know people. Let's talk about how to have healthy relationships or healthy dietary things that are meant to be positive things that are replacing the negative behaviors, and not just talking about the negative behaviors over and over and over and over.
Yeah. 100%. And time to just let your imagination and yourself just relax and trip around, not have to be accountable to somebody for something all the time.
And we're going to leave it there for today with the focus and awareness available to talk about PTSD. Want to encourage everyone to get out there and look for those signs in individuals, loved ones. Make sure that you're paying attention to those who may have suffered trauma, and whether you're aware of it or not, that there are those that are hurting and need help and support. Sometimes something as simple as forwarding things on the internet and social media that are healthy and useful can be a powerful way to do that. You can follow us as well at Opiates on Twitter, or email us info@opiates.com and see some of the things that we are putting out there and that we're spreading about awareness about addiction, recovery, and of course trauma and PTSD is a big part of that. Big thanks to Claire Waismann and David Livingston, as always, for being here to put this episode together. This show is produced by Popped Collar Productions. You can learn more about them at poppedcollar.net, and our music is the song Medical by Clean Mind Sounds. Remember to keep asking questions, because if you ask the right questions, you will be able to find answers. And when you find answers, you can find hope. Bye-bye for now from Waismann Method Opioid Treatment Specialists. We'll be here again soon.